9-year-old Nazar Motovylo has a large tumor behind his right eye. It has also caused a facial deformity. Because of that, he's been ostracized. Other kids won't go near him. They're afraid of the way he looks. His family's desperate for support. They arrive at the Children's Hospital in Lviv, Ukraine one day, and they meet neurosurgeon Dr. James Rutka, who, along with craniofacial surgeon Dr. Chris Forrest, agree to perform the highly complicated surgery. You made the whole thing possible through your support of the Herbie Fund.
He's trying to play the piano.
Our new friends from Ukraine have arrived in Toronto, and as always, the host families do their best to make them feel welcome.
See, he's perfect at playing. He's cute, he's nice to play with. I like to socialize with him a lot.
Просто по ньому видно, що він така, незвичайна дитина.
She went through a very hard time, especially when Nazar was becoming an older boy. To see how he starts paying attention to himself, that he is a little bit different in the face than other kids. It was very hard for her to see that.
He's exploring stuff and it's fun for him. And I just make it funner by staying near him.
So for my daughter to see that there is a kid in need, and even for her to open up her heart and play with him and teach him a few things and even tease him in a way, and he teased her back. That was lovely to see it together.
Добрий день.
Добрий день.
See you again. Добрий день. Yeah, so welcome to Toronto. Very nice to see you again from Lviv.
Yes!
You can just follow my fingers.
Nazar has a large tumor behind his right eye, which has forced the eye forward and ruined the eye socket.
So before we do the surgery, I definitely would like them to see the eye doctor just so we can assess the vision in both eyes and we know what we're dealing with. Well, this is
Neurosurgeon Dr. Jim Rutka first met Nazar and his mom in Lviv through the Ukrainian Pediatric Fellowship Outreach Program.
Ukraine's getting better, but they're not quite there yet, so we thought that this would be the best place for him to come for his surgery, and so he's also here on the Herbie Fund.
Hello. Hi. You are Nazar, right?
Nazar?
Chris. Very nice to meet you. I like your badge. And what's the reason that you came here today? What can I do to help you?
Операція.
For the surgery.
An operation.
Нормальне око.
He would like to have a normal eye.
Okay, all right. Watch my finger. It's interesting because he's got useful vision in that eye, which I wasn't sure about. So that's actually good, but it makes our job a little bit harder.
Here's the normal eye, that's the left eye. You can see the expansion of the right-sided orbit.
Can you open your mouth big and stick out your tongue at me? Good job. Excellent.
The complicating factor is that because of his condition, neurofibromatosis, he's got this tumor that you can see here that's going all the way out to the eye.
Quite large, isn't it?
It's a very large tumor.
Це для мене 6 хвилин.
Так, для тебе це буде отак.
What is he asking?
He wants to know how long it's going to take him to fall asleep. How many seconds?
Okay, mister. Let's hit the road, Jack.
I would never want to be in Helena's shoes because it's very hard. As a mom, I think it's the hardest thing to know that your child needs medical help.
Nice work. You must have done this before.
That's why every appointment I'm with her and every step of the way, and I try to do the best I can.
So the moment has arrived. Surgery has begun, and it's being done by two of the absolute best pediatric surgeons in the world. Let's take a look inside and check up on progress.
The plan is to try and reconstruct the missing bone in the roof of the eye socket and replace the brain back into the proper area where it should be and allow the eye to reposition and do it in a way that is done safely. We don't do any damage to the brain or obviously any damage to the eye.
Already you can see the difference. I mean, I know there's going to be some swelling and everything else, but that right eye looks 1,000% better.
Yeah, I must say I'm quite optimistic. We reconstructed the roof of the eye socket in a way that should provide him appropriate protection and also give adequate space for the eye to sit in the eye socket.
Wonderful thing to see. Thank you very much.
Okay,
Thanks, Gord.
Це унікальний шанс для мого сина. Він був дуже мріяв.
From the bottom of her heart, she would like to thank you here and take care of him and Herbie Fund, obviously, for sponsoring, because without them that would be impossible. So we just want to say thank you.
And we really wish we could take care of all children in the world like this, but you know, treating one child at a time, you know, also makes a huge difference for the world.
Tomorrow night, the final installment of our annual series, A World of Difference. All great stories with excellent outcomes, made possible by the best pediatric medical professionals in the world here at Sick Kids Hospital and your support of the Herbie Fund. To make a donation to the Herbie Fund, please go to herbiefund.com. Thank you.